Hi, this is Reggie from Restore Plus Physical Therapy, and welcome to today's tip of the day. In this video, I want to share with you 3 quick tips on how you can get your neck more flexible and pain-free. Studies have shown that incidence of neck pain can be as high as 86%. So basically, that's like almost everybody has had neck pain at least at some point in their life. Now, aside from back pain, neck pain is the second most common condition that we see in the clinic. Now, in this day and age with the computers and electronics, it's just becoming more and more common because of the way our position is every day. When you're working, everybody's like, slouching, looking down on the computer, or especially in their cell phone, everybody's looking down. So their posture is not really the best. So that leads to an increased occurrence of neck pain. All right. So in situations like if you've had neck pain before, maybe you've tried using patches, you've tried using like creams, taking pills, and maybe you found that they actually don't work permanently because they might give you some temporary relief, but it just doesn't work in the long run. All right. And I can give you a few, like 3 ideas or 3 quick tips on how you can get more permanent relief there. Okay. Now, having neck pain, it's for me, it's really, because sometimes I've had it, it's really annoying because it affects me in basically everything. When I'm working, typing in the computer, doing paperwork, if your job is a desk job, you feel that. Or even if it's just walking, sometimes the vibration, the impact, with the bouncing, that can affect it. Or sometimes you just wake up in the morning and your neck is hurting, and that's really annoying because you're starting off the day on the wrong, like they said, the wrong side of the bed already. You're not in a good mood already, so it affects your temper, your mood. I've had patients who said that they actually get depressed because of the neck pain. So I want to show you what these 3 quick tips are. All right. So number 1, I want to, basically, just to give you an idea of what we're doing, is we're trying to just relax or stretch key muscles around the neck area here. Okay. Because when you're like slouching like this, some of the muscles, like the muscles here in the front, they get tight, and the muscles around the back here, well, actually, the muscles here, the muscles back here gets tight, and the muscles in the front here get stretched, and the muscles here in the front gets tight here in the chest area because you're slouching, and the muscles back here in the like mid back shoulder blade area get stretched out. So we want to reverse that. Okay. So the first stretch that I want you to do is with your shoulders down. Okay. You can put your hand like behind your back, or if you're sitting, you can hold on to the chair, or just basically keep your shoulder down actively. And I want you to put your hand top of the ear here, okay? And then stretch to the side. Make sure the shoulders doesn't come up like this, okay? So stretch this way. You're gonna see in my situation here, you see the muscles come up. That means I'm stretching it. You hold it 20-30 seconds, and you do the other side. All right, make sure you keep the shoulder down, and make sure that you feel the stretch in the muscle here. So that's number 1. Number 2 is I want you to stretch like the muscle back here. So what I want you to do is very similar movement, but a little different angle. I want you to look at your opposite armpit. So I'm looking at my right armpit, for example, and I have my right hand be at the back of the head here. So make sure the shoulder is down again. You can put your hand on the small of your back like this, so that way it's actually keeping this down. Make sure you're straight and not slouch, and you're gonna pull back of your head towards your armpit. You're gonna feel the stretch in this area here. Hold that for 20-30 seconds, and you do it on the other side. To make it easy to remember, I tell my patients that's the smell your armpit stretch. All right, so it makes it easy for you to remember. So a lot of times my patients get confused, like with where do they, how do they position their head. Now, the third one that I want you to try is I want you to try and stretch the front part here, which are sternocleidomastoid in this area, it gets tight also when we're always like in this position. So how do we stretch that? I want you to pretend you're shaving. So you're gonna be doing this, right? You're looking up diagonally to that side and you're exposing this area. So it's kind of like when we have to shave, we go into this position. Okay, so I want you to try going that way and then put your hand here on your clavicle and your collarbone, that area, and I want you to push down. All right, you're basically grabbing the skin and then pushing down. You're trying to stretch the fascia there. Okay, so you do that, hold it 20-30 seconds, and then same thing the other side. You pretend you're shaving the other side. Put your hand, maybe you can line up your thumb in the clavicle area or your collarbone, go like this, and you push down, taking up the skin. So that way you're stretching the fascia. So I want you to try those 3 stretches, see how you feel, see if it helps relax this part here. For most of the patients that I've had given this to, they feel great relief because of the pressure is released there, muscles are looser, they usually end up with having less neck pain, more flexibility, and they actually feel even less stress and more relaxed because it just loosens up everything there. All right, so I want you to try that. Let me know how you feel. Leave your comments below. I would love to hear them. If you find this video helpful, you can like us on Facebook, subscribe to our YouTube channel, you can follow us on Instagram, or definitely you can share this video with your family and friends. All right, so till next time, I'll see you in the next video. You're awesome.